nurse today, Mr. Shaw. I'm going to be doing a health assessment. This is going to be recorded right there on that camera for a class project. Everything that happens is going to be confidential though. Only my instructor will see this video. Feel free to ask questions. I am going to be using some medical terms today, okay? It's going to take about 15 minutes, okay? We're going to start with your scalp. If you could look down for me just a little bit. And I did wash my hands before the start of this video to prevent the spread of infection. Okay, your scalp looks clear without lesions. No parasites are noted. Your hair is evenly distributed. It is black and coarse and curly. Okay, and your head is normocephalic as well. Okay, next we're going to move on to your face. Okay, move your hair just a little bit. Okay, so your face is even in color, uniform throughout. It is symmetrical. Next, I'm going to be looking at mostly your eyes. You do have eyebrows present. They are coarse, black, evenly distributed, and without scaliness or lesions. Okay, you do have eyelashes on the both upper and lower lids. They are everted. Okay, next I'm going to use a pen light. It might be a little bit bright, but we're going to check a few things out, okay? Go ahead and look towards me. Okay, look at my pen and follow it. Okay, follow it back out. Okay, your pupils are equal, round, reactive to light, and accommodating. Your irises are dark brown. And I don't see anything, no drainage, anything like that in your eyes. They're without redness. Okay, next I'm going to look at your nose. Okay, your nose is midline without deviation. I'm going to check for narrow patency. I'm going to go ahead and plug up one of your nostrils. Okay, take a deep breath. Okay, we're going to do the other side. Take a deep breath. Okay, and then to test for the olfactory nerve, we would just have the patient plug one of their nostrils and sniff something very strong to see if they could detect the odor, and then you would do the same thing on the other side. Okay, next we're going to check your mouth. So just looking on the outside, your lips are symmetrical, they are pink, they are moist without cracking, and I do not see any lesions. Okay, I'm going to have you open your mouth. There's a few things we're going to look at. First, we're going to look at your cheeks, your tongue, underneath your tongue, your uvula, your tonsils, and your teeth and hard and soft palate, okay? So go ahead and open your mouth for me. Okay, your buccal mucosa, it looks pink, moist, without lesions, okay? Your tongue is pink with a little bit of white patches, which is perfectly normal. Your hard and soft palate are continuous. Your soft palate is white and your hard palate is white and your soft palate is pink. Go ahead and stick your tongue out for me. Okay, everything stayed midline. Go ahead and put your tongue back in. Go ahead and smile for me. Okay, your teeth are white and look in good repair. I'm gonna have to lift your lid up just a little bit. Okay, your gums are pink. They are stippled and they are without lesions or bleeding. Okay, open your mouth one more time for me. Stick your tongue out and say "ah." Okay, your tonsils are present without swelling or exudate, and your uvula is midline. Go ahead and swallow for me with your mouth open. Okay, good, your uvula stayed midline. Okay, next we're going to move on to your ears. Okay. Okay, no foreign objects are present in this ear, and you've got a small amount of cerumen. Turn your head that way for me just a little bit. Okay, same with this ear, no foreign objects are detected, and you have a small amount of cerumen, which is earwax. Okay, I'm going to go ahead and feel right here on your facial and your maxillary sinuses. Do you have any tenderness there? Okay, I'm going to put my pen light away now. Okay, I'm going to feel through here. Feel any tenderness there or on your tragus. Okay, I'm going to bend your ears just a little bit to see a recoil. Okay, perfect. Go ahead ahead and lift your head up for me. I'm going to check your neck now. Okay, I do not feel any lymph nodes present. I'm also going to palpate all the way down. Okay, we're going to do some range of motion exercises. I'm going to have you do what I'm doing. We're going to turn our head to the right, okay, to the left, down, and back, and go ahead and do a good circle for me. Okay, I did not hear any crepitus during that. Did you have any pain doing that? Okay. Go ahead and feel your spine as well. Okay, any pain noted there? Okay. Okay, next we're going to talk about how to do a self-breast exam. We're not actually going to demonstrate that today, but we are going to go through the proper procedure, okay? I'm going to have you do the 3 positions for me, so go ahead and mimic what I'm doing. Sitting up straight, and then here, and then we're going to go right above our head, okay? So first we're going to go over the color of the breasts. In general, the breast should be the same color as the rest of your skin tone. Your nipples and areola will be darker though. When you squeeze your nipples, you should not have any discharge. If you do, that's abnormal. And then just in general, in any of those 3 positions, you should not have dimpling or retractions of your skin. If you notice that, you should contact your healthcare provider. And there are other options as far as checking the breast for lumps, but my favorite is doing the wheels on the spoke. You're going to start at the nipple. You're going to work your way around, kind of doing like this, just to feel for any kind of lumps or anything abnormal. You're also going to go all the way up into your axilla, your armpit area, and you're going to feel for any lumps or inflamed lymph nodes there. Do you have any questions for me?
No.
You should do this once a month to check for any kind of abnormalities. Okay? I'm going to have you close your eyes, and then I'm going to have you resist me opening them. Go ahead and close your eyes. Okay, looks like facial nerve is intact. I'm also going to have you close your eyes. I'm going to touch you somewhere on your face, and I need you to tell me where I'm touching. Okay, close your eyes.
Left forehead.
Okay.
Right cheek.
Okay.
Nose.
Okay, perfect. Okay, so that shows that your trigeminal nerve is intact. This can also show that. Go ahead and, there you go, bite down for me. Okay. Okay, biting down is strong and equal bilaterally. Okay. Next, I'm going to go ahead and feel for your carotid arteries, one at a time. Okay, strong, +1. Strong, +1. I'm going to go ahead and listen for a bruit now. I'm going to have you hold your breath while I'm doing this. Okay, go ahead and take a deep breath and hold it. Okay, no bruit is noted. Same thing on this side. Okay, also no bruit is detected. Okay, I'm going to go ahead and start checking your chest now and your back. Go ahead and stand up for me. I'm going to check a lateral view of your spine. Okay, and it does make an S curve. Okay, go ahead and sit down for me. I'm going to auscultate your lungs. Just breathe normally for me for this part. Your lungs sound clear bilaterally upon auscultation with no adventitious sounds. I'm going to percuss. Okay, resonant sounds are noted on that side. Okay, there as well. Okay, just lean forward for me just a little bit. You don't have to get up. I'm going to check your lung sounds in the back. Go ahead and take a deep breath for me for this one. Okay, and again. Okay, lungs sound clear and equal bilaterally. Let me see your fingers for me. I'm gonna go ahead and check your nails and your capillary refill time on your fingers and toes. Okay, it's 2 seconds. And again, 2 seconds. And the skin around the nails is neat, without any kind of scaling. The fingernails are trimmed and pink in color and are convex. Okay, go ahead and check your toes real quick. Okay, 3 seconds. Your toes are a little bit cold. 3 seconds, okay? And again, the skin around the toes is even. It doesn't have any tearing or bleeding. The nails are trimmed and convex, okay? And since your toes were cold, I'm gonna go ahead and feel your skin temperature here. Okay, feels warm bilaterally. And then you do have two tattoos present. The first one is your right forearm, and it's geometric in shape. And then you also have a tattoo here on your upper right arm, and it is a music symbol. Okay, you also have piercings bilaterally. Okay, any other piercings that you have? Okay. Now, at the beginning of this assessment, before you had come in, we did some vital signs. Your blood pressure was 110/63, which is no retentive. Everything's fine there. You had a normal sinus rhythm. Your heart rate was at 67. You did not have a temperature. You were afebrile, and your respirations were at a 16. So really, all of that's within normal limits. The next thing that we're going to do is a 4-word test. I'm going to see if you can remember it. I'm going to say 4 random words. I'm then going to ask you a few questions. We're then going to come back to those 4 words. Okay? So I'm going to say lamp, grass, dog, and car. Okay, and where did you go to high school?
High.
Okay, what year did you graduate?
2011.
Okay, can you repeat those words back to me?
Lamp, grass, dog, car.
I struggle with it as well, okay? I'm terrible with memory. But you did really good. And other than that, you've kind of had a flat affect this whole time, and you've been able to answer all my questions. You are alert and oriented. You know where you are. Okay, where are you?
Westside Creek Apartments.
Okay, and what year is it?
2018.
Can you state your full name for me?
Rusch.
Okay, everything checks out to me. If you have any problems, you can always, give us a call and we can check on you, okay?
Thank you.
You're welcome.